had this idea for a show. Different women, different points of view. Maybe a little too different. We call it The View.
A little less than 6 months ago, at 81, Hazel York decided that she wanted to get a facelift. But before she went under the knife, she came here with her plastic surgeon to tell us all about it. Take a look.
In your life to make you decide to have a facelift?
Since I found a new husband, I'd kind of like to start life over.
Show us exactly what you're going to do.
This is the area of incision to lift the cheek and deepen the neck.
Now, do you get a little nervous looking at this? Because
No,
you're excited.
anything would help that.
Well, I thought she looked great before, but this is D-Day. Please welcome back Dr. Grossman and the brand new Hazel York. Hazel, you look great.
Great.
How are you feeling, and are you happy?
Very happy.
Yeah.
Very happy. Very happy with the results. I got just what I wanted. Good doctor. And I didn't get him, but you know. Anyway.
Now, I know the area that you were most concerned about was your neck area.
My neck. That was the main thing.
And we have a before and after that
Look
shows
at the difference. Look at that.
That is unbelievable.
It was worth it just for that.
Yeah.
Right.
You know?
Yeah, it was.
Yeah. I mean, that could flap
totally
around and hurt somebody.
Not yet.
I don't like it just like that. Okay, now, you know, you told us the last time you were here, I remember these words, that when you look in the mirror, you saw heartache all over your face. What do you see now?
You never forget heartache.
Yes, ma'am.
But I see a happiness. I see a lot of things that I forgot about doing, like, hey, getting up and going. We're planning a Hawaii. We're going to Branson. And, hey, I'm going now. And I feel great.
Well, you would have done that before, too, probably, right?
Oh, yeah, but I wouldn't have to have as much fun.
Yeah.
Hazel, in that clip, you said that one of the reasons is because you have a new man in your life, and Damon, your husband, is here with us. You two are newlyweds. So, Damon, you said that Hazel didn't need it. You thought she was beautiful the way she was. But what do you think?
Well, you know, love is blind, and that's what I thought, but I see the end result.
Really? Are you more turned on now, Damon?
Oh, yeah.
He didn't need it. No Viagra for Damon, huh?
Excuse me, way too much information,
Good for you. Listen, Dr. Grossman, the last time you were here, you gave us an idea of what a typical facelift procedure looked like. Okay? So we sent a camera crew with you to follow Hazel and you around and talk to us. Tell us about Hazel's procedure.
Well, here I am marking beforehand my landmarks because, of course, once she lies down, things change. Making the details of what I plan to do, and we're taking her now to the operating room, and she's being put to sleep. I'm remarking, and then I'm going to be injecting a fluid here that reduces the bleeding and lifting the face and lifting up the tissues. And here I've lifted it, getting ready to reposition, and here I've used a fibrin sealant, a glue, that allows me to do the procedure without a dressing, without a drain, and to accelerate her healing process.
Wow. The glue's at the point of the incisions, you're saying?
It's underneath where I've lifted. It lies beneath that and allows the tissues to adhere to the raw space beneath so that the space is obliterated.
So you're using, that's just the skin. You know, people think the whole thing is lifted up.
Well, the thing, it is all lifted up.
But the whole...
Everything.
Gotta go
we
under.
cut out a segment where we were tightening the muscles as well.
Okay, because that would have made it...
You said that there were risks that are involved the older you get in any kind of surgery, but also in this. Did you have any complications at all?
No, not at all. But we were smart in what we did, and beforehand she had a thorough examination and a heart test and a variety of things. And where we thought about doing a little bit more, we were prudent and didn't add additional operating time, and so everything worked out beautifully.
And what was the cost?
Golly, I don't know, but what I would tell you is that...
Start saving your money.
You're probably talking about a surgical fee in the $10,000 to $20,000 range, and an operating room and hospital
But
cost
Hazel got a discount from you, right, Dr. Grossman?
Absolutely.
Yeah.
Okay.
I would like to inject one thing. When I woke up, I was expecting all these bandages, everything.
Yeah.
I didn't have a bandage on my head. I had very little bruising, but I didn't look at the mirror to see if I was swollen.
Oh.
But I was shocked.
What
I
was the
actually-
recovery like, actually?
Pardon?
Recovery from the time you woke up to now. How was your recovery?
Well, I think he could answer how my recovery was.
Well, tell us, but from your perspective, too.
Did it hurt? Were you swollen?
No.
There
There was very little pain,
Yes, ma'am.
and I heard very clearly when he asked me where to look and what not to look at.
Our biggest problem was Hazel falling out of bed the morning after
Oh, I wasn't
surgery and
gonna tell
almost
that.
hurting herself.
But Doc, how would you rate her recovery, and how long until she's
Very-
totally healed?
Well, I mean, I think that at this stage she is fully healed. She has areas that are numb, and areas that are a little bit mildly swollen, but she really is where she's going to be for the
And how
prolonged
many
period
months
of
was
time.
that about?
This was done
2 months ago. Amazing.
Excellent.
Now, Hazel, last time you were here, I said, are you going to do anything else? Like, don't do the breast implants. Remember what I told you?
Well, I've had second thoughts.
Really? Are you going to do something else? What else do you want to do?
Yeah, my feet need working
Oh,
on.
he doesn't care. Unless he's a foot fetishist, who cares?
No.
Have you inspired other people in the retirement
Oh,
community
I've
that you live
caused a
in?
lot of controversy,
Yeah?
I'll tell you. But I've got a lot of compliments from men and women.
All right. Oh,
And
yeah.
hey, it's worth it.
Well, I guess you and Damon are going to move to Sweden where they have that all porn all the time station. The only place to go now.
don't need it.
Our thanks to, she says they don't need it. Our thanks to Hazel and Damon York, and of course to Dr. John Grossman. We'll be right back. Where did I get it?